Hi everyone, my name is Ashley Gallagher, and I did my topic on the Pima Indians who live in Arizona. This back screen is a picture of one of the rivers that one of the reservations are on. Very beautiful in Arizona. So the Pima Indians are located in Phoenix, Arizona, which is near the Gila and Salt Rivers. This population refers to themselves as the river people because of these two rivers and because of their elaborate irrigation canals, which was part of their traditional lifestyle over generations, as well as farming. The main types of farming were different corn varieties, beans, and squash. Present day, there are 3 reservations that the Pimas live on. Throughout the Pima's lifespan, a major lifestyle change was when the California Gold Rush occurred. White settlers came to take their land, so they were forced to move away from their irrigation system, their fertile land. So this is a big impact to them because it changes their food intake, physical activity, because they're no longer farming, which is labor intensive, as well as their economy. So they went from a farming lifestyle to with working on the fields to food scarcity and sometimes even famine, as well as sedentary lifestyles because of minimal labor. So they went from a well-adapted lifestyle to a poorly adapted lifestyle because it was such a culture shock because they weren't sure what they could do on this new land. It wasn't as fertile. They didn't have a river to make their irrigation systems. So their diet did change. They went from a low-fat, high-carb diet to mostly 40% of the diet being derived from fat, mostly like high-fat animal meat. So there was a study conducted in 1965, which documented the Pima Indians having the highest prevalence of diabetes ever recorded. I'll talk about that study more later. So background of diabetes. Diabetes is a chronic disease that occurs when your blood glucose or blood sugar is too high. And then the hormone insulin, which is secreted by your pancreas, its role is to help convert your glucose or convert the glucose from your food so it can help our cells have energy to keep us going. And since in some people, their body do not make insulin or their body does not make enough insulin, all this extra glucose is in our systems and that can cause health problems. So there's 3 main types of diabetes, including type 1, type 2, and gestational diabetes. Any of these diabetes can lead to other health issues such as heart disease, stroke, hypertension. So type 1 diabetes, the body does not make insulin at all. So this happens when your immune system destroys the cells of your pancreas, whose job is to make the insulin. That is why individuals with type 1 diabetes have to take insulin every day, because without it, they won't survive. They have to do it every day because we need it. Insulin is needed to survive. And then, so individuals with type 1 are most commonly diagnosed as young children, young adults. Even later in life, some people are diagnosed late or develop, or, Type 2 diabetes is the most common in America. The body does not make or use insulin efficiently, and this is associated with poor lifestyle choices. This can happen at any age, but it's more common in middle-aged or older adults. Some of the common symptoms of type 2 diabetes is frequent feelings of thirst and urination, fatigue, blurry vision, numbness in hands and feet, such as tingling or even pain. The third one is gestational diabetes, which develops in pregnant women. It's difficult to detect because there aren't symptoms like I just mentioned in type 2 diabetes, which is why it's important for women who are high risk of gestational diabetes to be tested early in pregnancy, such as if they're overweight going into their pregnancy. Often, this form of diabetes goes away after birth. It can develop into type 2 diabetes later in life, as well as the newborn. If their mother has gestational diabetes, they have a genetic predisposition to having diabetes later on in their life, whether it's type 1 or type 2, or other metabolic disorders such as PCOS or thyroid disorders. So combating diagnosis in diabetes. So if a family history of diabetes, it's important to make conscious, healthy lifestyle choices, which include a balanced diet, such as high fiber diet and limit fats. Eat like your fats and your sweets in moderation. That includes portion control, physical activity, and stress levels. Stress can impact us in many ways, and especially medications for diabetes. Since there is no cure, type 1, those individuals take insulin. Type 2 diabetes, they use metformin or medications to lower A1C and help with weight loss. I mentioned a few below, such as Ozempic, Saxenda, Trulicity, Victoza, and Wegovy. In gestational diabetes, individuals take insulin Lispro, which is insulin that acts very quickly because the woman is pregnant. Also, those individuals take metformin. Prevalence of diabetes among the Pima Indians. It has the highest rate of type 2 diabetes in the world. More than 50% of this population has a diabetes diagnosis. In 2014, the CDC calculated that 34.2% of Pima men have a diabetes diagnosis, and 40.8% of Pima women have a diabetes diagnosis. Associated risks of having diabetes is genetic predisposition, poor lifestyle choices such as an unhealthy diet, low levels of physical activity, environmental circumstances such as the loss of adapted lifestyle and the fertile land, such as mentioned earlier about how the land was taken away, so they had to figure out a new lifestyle that could work for them. But genetic predisposition to diabetes and diet. So the Pima Indians have a progressive beta cell dysfunction, which is related to insulin resistance. So they'll have insulin resistance, and if they don't seek primary care to help manage insulin resistance, this will eventually develop into type 2 diabetes. Also, if the person does not have a healthy lifestyle, it just happen faster. Another aspect of the genetics is their thrifty gene. This happens in other Native American populations as well. This is when from ancestral generations, the bodies have adapted to the unpredictability of food sources. So the gene stores food in the form of fat when food is in excess to ensure that there's an energy source when the food is not accessible, such as when there's food shortages and famine. So this gene most likely developed after the Pimas were kicked off their land and had to fend for themselves away from their traditional food food sources of farming. The diet that the Pimas follow till present day right now is high fat, low fiber diet, and this is known to contribute to obesity and diabetes. This was the research study I mentioned earlier, the one that started in 1965. It was, it's been going on for up until 2015 when this was published. So the Pimas in Arizona, they started in 1965, but the Pimas that live in Mexico, they became a part of the study in the 1990s. So these were two populations with similar genetics, but they lived in different environments. So they were able to compare the two and see how their different environments, if they're, since they have the same genes, if the different environments had the onset of a diabetes to occur. So this is traditional versus modern lifestyles. So the Pima Indians in Mexico remain to have the traditional lifestyles that the Pimas in Arizona originally had. So they did not have an abrupt change in environment that affected their ways of life, such as the Pimas in Arizona, who had to develop a modernized lifestyle. So from this study, the findings were onset of diabetes exacerbated by environmental conditions. The Pima Indians of Mexico have drastically lower rates of diabetes compared to the Pima Indians of Arizona. So environmental circumstances, the transition from traditional to modernized lifestyle was associated with increases of diabetes and obesity prevalence, regardless of genetic predisposition. So past traditional lifestyle served as a protective factor. That's why there was lower rates of diabetes in the Pimas of Arizona before they had to join this modernized lifestyle, because they were no longer eating healthy or having high levels of physical activity from the labor. They were taken away from that protective traditional lifestyle, and the modernized one was not a good fit. They poorly adapted to the new lifestyle. Now present day modernization is inevitable, and so there is the good and bad consequences. The proposed communication that I came up with. So currently there's the Indian Health Service created a tribal leaders diabetes committee. At this committee, the leaders discuss how funding is allocated for the special diabetes program for Indians, and how, so these leaders serve as representatives because they're the leaders of the community, and they go back to the reservation and they try to set up these programs with toolkits, they call them, with health information. But one thing I would like to improve upon is that these are not necessarily culturally appropriate. They're not specialized per tribe, because it's not one size fits all. They should be catered to each tribe because they have different culturals. They have different cultural meals. They have different cultural events, different ways of life. So I would like to utilize this leaders community connection to be able to distribute diabetes health information through the format of a brochure. So first I would like to help, use the committee leaders to get feedback to be able to what they think will be culturally appropriate and effective information, including brochures of what their members of society can do to less likely to for the younger generations to not get diabetes, and as well as for those who do have diabetes to manage their diabetes better. So these would be distributed in popular public areas on the 3 reservations that the Pimas live on, as well as cultural events. I chose brochures because they can reach all ages, because there is limited internet on the reservations. So that's why I didn't pick social media or the news station, just because it's not a constant that all ages can get to. I was thinking mail, but mail does not go to all the reservations. There are PL boxes, but just didn't seem like a reliable source to send these out on. So the brochures would be updated monthly, and they would include reminders to seek primary care and monitor blood sugar levels, as well as going to an endocrinologist to make sure that someone has pre-diabetic, if they can, so they would be advised to do healthier lifestyle choices so they don't develop type 2 diabetes. Also educational diabetes and medication information, just keep repeating it, just so it could help more people, because there will be more health information out there for the population amongst their people. A fun aspect could be including cultural meals made with healthy alternatives, so they can still eat their cultural meals, but just changing out white rice or brown rice, like stuff like that, and beginner workout plans. My expectations for this, I hope to decrease the incidence or new cases of type 2 diabetes in the Pima Indian population of Arizona, especially for the younger generations, because they most likely don't have diabetes yet. 2, increase health education about diabetes prevention and how to manage diabetes, such as talking about medication, proper diet, and exercise routine. 3, tribal leaders committee promote lifestyle changes to aid diabetes management, health outcomes, and foster longevity. In regards to COVID-19, individuals with diabetes have a higher likelihood of having serious health complications if exposed to COVID, such as hospitalization or death. If a person's diabetes is well managed, the risk of serious COVID health complications is decreased, therefore less likely to have to be hospitalized. If a person is vaccinated from COVID, there's a lower risk of hospitalization to occur. I found a news article from May 2020, and the rate of confirmed cases of COVID-19 was 1.6 times higher in the Pima Indian population in Arizona compared to the white residents in the county surrounding the 3 reservations that the Pimas live on. There's not too much information discussing the COVID deaths on the reservations, just because it hasn't been collected or documented, or at least not published. And but there was a few articles mentioning how the high rates of deaths among the Pimas were the elders, and it was sad because it was the ancestral, the generations are dying, and the people who still who hold the traditions, the customs, the dialect. Also, due to the high prevalence of diabetes in this population, they are likely to be disproportionately affected by the ongoing pandemic. My references. Thank you.